moving from focusing on individuals with prescriptions and counseling and moving to the context in which many individuals live, populations, communities, where people play, pray, sleep, eat.
What do you think is the impression that people have today of the current system?
So I think people's current impression is made clear by the fact that when we hear the words health care, what we think in our minds is medical care. And we think about doctors and we think about hospitals. And where we need to be is when we are thinking more broadly about all the things that might contribute to one's good health, and all the things that might detract from one's good health.
What are some of the cultural or other factors that you feel contribute to the way people currently see the system of healthcare?
One, some folks are less trusting of the medical care delivery system.
Where does that come from?
Ooh, that comes from history. That comes from a history that has not been forgotten, of research that's done in a way that put people in harm's way. A system that today doesn't look like the people it serves or a community.
And so at the ground level, people don't trust hospitals and they don't trust healthcare?
I think on a ground level, it's about not feeling comfortable in that setting. It's also sometimes the fear that going to the hospital is going to result in a bad outcome instead of a good outcome. That in fact something that might save your life can happen in a hospital setting, but feeling like either fate is playing its hand, or you've reached a point where nothing can be done.
Do you feel like gender plays a role in it? Do you feel men are less likely to, especially men of color, are less likely to engage the healthcare system than, let's say, women of color?
There's no doubt that there is a gender difference. And actually that gender difference extends across races and ethnicities, but it's more pronounced among Latinos and African Americans.
What about regionalism?
Regionalism absolutely exists. So
are people in the South less healthy, more healthy than the North, Midwest, South?
You had it right the first time. So generally in the South, sometimes called the stroke belt, it is a place where, with regards to health statistics, African Americans in that part of the old South states, and then in the Southwest, Latinos and Hispanics have conditions that confer worse outcomes. So they're more likely to have diabetes, they're more likely to have hypertension, they're more likely to have experienced strokes, heart attacks, and sometimes not survive those things.
What's interesting to me is how the education system and the healthcare system have the same outcomes, where African Americans, Latinos, and the poor, when economics are added into the equation, perform worse in the education system as well as the healthcare system. And I'm of the belief that one of the reasons why many African Americans and Latinos do not fully engage in the healthcare system is because of a lack of education. And I'm not talking about the large E education, but the small e, the general understanding of the implications of decisions that they do or don't make, as well as the systems themselves. What I see is that the single greatest quality of life indicator is how much education you receive. And one of the things that I've seen that happens is that our children are not receiving access to a quality education, and as a result of that, they don't see health and health care as part of their responsibility. They see the systems as things that are put upon them. As you educate people more, they see that they can impact systems as opposed to having systems impact them. And in our schools, we have a 2-sport requirement. And we had to fight the state to get a 2-sport requirement. With our 2-sport requirement, which is the same thing that you'll see in private schools, is it engages children in a lifelong pursuit of physical fitness.
Mhm.
We've seen children lose as much as 100 pounds in a year because they can't eat the sugary drinks because they have to go to football practice or basketball practice or lacrosse or field hockey or skiing or snowboarding. When they know that it's part of it, then they're having healthier conversations. And those are the types of conversations that middle and upper middle class people tend to have. They start to have these conversations. As their education increases, they understand the implications of the decisions that they make.
One of the things that I like to say is that fit kids are smart kids. The evidence is quite compelling that when children are eating healthfully, are engaged in physical activity, their brains are more engaged in learning.
But you may want to clarify, because I think sometimes people think skinny is fit.
No. So my definition of fit is eating healthy and being physically active.
Because it's easy for, especially within the Black and Latino community, where we seem to have a greater comfort with people who are larger, there's a notion that if you're skinny, then you're healthy.
And if you're skinny and physically active and eating healthfully, you're healthy.
There you go.
And if you're not so skinny and eating healthy and being physically active, you're healthy. But the key thing from the Heart Association's perspective, at least for children, is about healthy eating and physical activity.
One of the things we also don't consider when we're talking about taking care of oneself is sexual health. A lot of our children who may not value themselves, and adults who may not value themselves, can engage in dangerous behavior that increases the probability that they will become unhealthy as a result of some decisions that they make around sex and sexuality. Is that something that you see as well?
One of the things that we talked about before we started taping had to do with what goes on in the home and the degree to which we can engage parents and have them part of the education solution and health solution is the degree to which healthier homes become places where risk-taking of all sorts happens less. So there's some evidence out there. Here's an example of healthy eating. Evidence that families that eat as a family, eat dinner as a family, less likely to have children engage in risky behavior of all sorts, but also more likely to eat healthfully on a daily basis. So it's a twofer. You get healthy eating and you get less risky behavior.